Hello and welcome. In 2005, then US President George W. Bush read a book called The Great Influenza by John M. Barry on the 1918 pandemic while he was on vacation. He came back and decided to form what eventually became a biodefense directorate. The person that was found to head that directorate was Dr. Rajeev Venkayya, who in turn brought in other doctors to write a pandemic plan for the United States of America, which was written apparently in just 6 hours, according to Michael Lewis, who in his recent book, The Premonition. So the book, of course, talks a lot about how the United States either prepared or did not prepare adequately for the pandemic that followed in 2020 and into 2021. But more importantly, I think, are the lessons that nations could learn, have learned, perhaps even going back a century, as they have tried to prepare and will eventually prepare for subsequent waves of coronavirus. So to discuss this, I'm happy and pleased to be joined by none other than Dr. Rajeev Venkayya, Managing Director of the Global Vaccine Business Unit of Takeda, also a board member of the Coalition of Epidemic Preparedness Innovations, or CEPI. Dr. Venkayya is originally a specialist in pulmonary and critical care medicine, but now more of an executive, but also has spent time in government working on, as I said, the pandemic plan for the United States of America at that point. Dr. Venkayya, thank you very much for joining me. So firstly, just to get that out of the way, how did the Bush administration at that point find you and bring you into this role under the Department of Homeland Security?
Well, thanks, Govind. It's great to be with you today. I actually came into the government through a White House Fellows program. I had previously been working as a pulmonary and critical care physician and researcher in California. That brought me into government, but then when I got there, I saw that there are ways that physicians with their technical background can contribute to government policy, particularly in areas like biodefense and preparing for pandemics.
Right, and tell us about what's transpired since then. I mean, you wrote a document, and that document led to about $7 billion being put aside to prepare and fight this. Now, did everything happen? I know I'm asking you to sum up a lot of material in a very short time, but did things move the way you thought they would?
The infectious disease, coronavirus, moved the way that we would have expected a flu virus to move, essentially. What didn't work the way we had hoped is that governments did not respond the way that they could have. And we found that because of the social media dynamic, we saw a lack of and loss of trust in the public because the science was moving so fast. And frankly, leaders were not doing as effective a job at communicating the science as it was developing. And so as a result, we had I would say, a disconnect between the reality of the epidemiology, what actions leaders were taking, and how the public generally understood it. I do think that the mitigation measures that were identified back in the 2005-06 timeframe to buy time until a vaccine would become available were very much in the right direction. The challenge was that these things need to be done early, they have to be coordinated, and they have to be done with strong leadership, because in many cases, it's hard to ask people to do the things that we've asked them to do.
Right, and you've talked about this in other presentations that you've made, the disconnect between science and leadership. So how does that, I mean, in India, for instance, we are now seeing the ebbing of the second wave and are now mentally, at least seemingly, preparing for the third wave, which we, of course, don't know what it's going to be about. So how does leadership play a better role in transmitting the knowledge from science or responding to changes in scientific understanding?
Well, certainly leaders in many countries have access to the best science and the most up-to-date information about something like a pandemic. And it's one critical responsibility of a leader to bridge between the complexity of the science and what it means for individuals and what actions they can take to protect themselves and their families. But another key role of leaders is to manage risk. So when we think about the pandemic and the experience of 2020, many countries developed a sense of complacency, I would say, because of various reasons. They believed that their population was somehow special, or the climate was such that it would be hard for a virus to be transmitted. Now, it's okay as a leader to hope that that's going to be the case, but as a leader, it's your job to manage the risk that it is not going to be the case, and in fact, prepare for the worst. Now, this is hard. The great thing is, though, that governments have the resources that you need to do that kind of preparation. This is the trust we put in governments to plan for the low probability but high consequence events. And there are lots of things governments can do in that regard.
Right. And you talked about the exception to the rule syndrome, right? So in India, for instance, some of us thought at that time, which is not too long ago, that because we are Indian, we are exposed to the environment that we are perhaps more resistant to diseases or viruses like this. And I'm sure you've heard this too. What is your reaction as someone who understands maybe a little bit of this environment and as a person of science?
Well, let me first say that it is not just the non-experts that believe that. There were many experts that didn't quite understand why things were not developing in India the way they were in places like Italy and in the US. And so we came up, many, including scientists and experts, came up with theories to explain that. So this was not a perception that was limited to people that were not scientists. The reality is we just don't know enough about this virus and how it's transmitted. And frankly, in many cases, we've been a bit overconfident about what we do and don't know. But now that the world has been given notice, that even the places we thought would be spared might not be spared, this is a time when all countries need to redouble their preparedness efforts. And that extends across a spectrum of activities, including things like vaccines, but also the public health infrastructure, and very importantly, building the trust with the public so that when a leader says you need to do certain things like stop large public gatherings, that people will trust them and listen to them and do exactly that to reduce transmission in the community.
Right, and in some ways, Dr. Venkayya, what you're also saying is that while science has a responsibility and will continue to in the days ahead, it is equally incumbent on leadership to manage and drive the public response and how I guess the outcome of this the impact of this virus will be decided.
That's right. I mean, leaders need to project a sense that they understand as much as is possible to understand at a moment, to share that information with the public in an actionable way so that the public knows what they should be doing now, but also to mentally prepare them for the different scenarios that can unfold. Of course, saying that we hope that it's going to go in this direction, but if it's not, there are things that we, the government, and you can do to prepare for that negative outcome, to mitigate the illness, the suffering, and death that could occur if that happens.
Right. Let me come to vaccines now. I mean, in India, we're picking up pace when it comes to vaccines. Some other countries, including the United States and the United Kingdom, have progressed much further ahead, particularly when it comes to the vulnerable population. So tell us about how you are seeing from your vantage point as a vaccine company, as well as someone who's part of the Coalition for Epidemic Preparedness, the demand supply of vaccines at this point. Where do you think we could reach in coming months, and what is likely to happen in the period that we are not able to vaccinate as fast as we should be?
Well, first of all, let me say that it's not a race between countries. It's easy to look at this as a race because we have access to data that shows how many people are vaccinated in one country versus another. What we should all be working toward, and when I say all, I really am looking to the leaders of governments that have the financial resources to invest in vaccines and manufacture them. We need to be thinking about equity and ensuring that there is some fairness in timing of availability of vaccine and, of course, the volumes of vaccine that are available in different parts of the world. India is in a unique position because there is a vibrant, incredibly capable industry in India with great companies that have a lot of experience in supplying vaccines to the entire world and in large volumes. I think those that are watching this program will understand that India is the most significant supplier of global vaccines in the world. And so there is an opportunity here for the government to really partner with industry to scale up the manufacturing as quickly as possible. Importantly, it has to be done in a way that recognizes the technical difficulties in doing that. Vaccines are not like HIV medicines. You can't flip a switch and have 10 different companies making the same medicine overnight. It takes months to transfer the process to make a vaccine from one company or facility to another. And if you don't get it right, you risk having a vaccine that either doesn't work or, in the worst case, is not safe. And that's why a lot of effort has to be put into that those transfer timelines. I think this is where, in retrospect, for many governments, there probably could have been more partnership early on at risk to make some investments just in case huge volumes of vaccine would need to be made available very quickly. If you recognize that situation in a moment, that's not the time when you can make a difference. You have to actually take action months in advance in order to be prepared for that moment.
Right. So if you were to look at the demand supply dynamics today, I mean, let's put aside the countries, and as you said, this is not a race, but I guess we want most of humanity to be vaccinated by a certain date for all of us to be safe or safer. So how would you look at where we are today versus what we need to achieve or the outcomes that we want?
We're in a very difficult place right now. The world has about 2.5 billion doses of vaccine that have been distributed. The vast majority of the doses have gone to the wealthiest countries in the world. The problem is scarcity, and as I've said, scarcity is the enemy of equity. You need to generate volumes of vaccine very, very quickly so you don't have to deal with these difficult equity challenges. But as I've said, it's not easy to do that scale up very quickly. And so I would say that while we are in a much better position today than we were a year ago, because the good news is that vaccines actually work, and the reality is that COVID, or the SARS-CoV-2 virus, is not as hard a virus target for vaccines as perhaps it could have been. And we had some good science before the epidemic or the pandemic began to inform our vaccine development efforts. So there are a lot of good things. The fact that we do have multiple companies around the world with vaccines that work is a great thing. That means that we have more capacity to apply to this challenge. Now we need to do the hard work of the transfer of technologies to as many manufacturers as possible to make high quality vaccines for the world. Some estimates are optimistic that by the end of this year, we could have over 10 billion doses of vaccine available. I'm a little bit skeptical about some of those investments, but if we can actually achieve even 3/4 of that or half of that and ensure some level of equity, we'll be in a much better place in terms of managing the situation at the beginning of 22 than we were at the beginning of 21.
Right, and you've touched upon the efficacy of those vaccines. So tell us about what you understand about the efficacy of these vaccines and your confidence in them, so as to explain particularly to those who are watching, and more so, I guess, from our point of view or from where I'm sitting, the fear about the Delta variant and now a newer version which is cropped up called the Delta Plus variant.
So the good news is that most of the vaccines for which we have data available show that they are safe and that they are highly effective against preventing the more severe forms of the disease that could put a person in the hospital or even lead to their demise. And that applies to the mRNA vaccines, the vaccines that use what we call vectors, like the J&J and AstraZeneca vaccine, and the vaccines that use inactivated virus that has been grown up and killed. Now, there are some differences in the efficacy of these vaccines in preventing illness. And that's notable and important, but the most important thing in my view is the prevention of severe disease, and there the news is very good. Now, the news is also very positive when it comes to the variants in terms of the vaccine efficacy. We do see that although there is some reduction in the ability of vaccines to prevent the illness itself, the prevention of severe disease still appears to be very high. So that's good, very good news. Now, the Delta variant that you're talking about is concerning, I have to say. When we see a new variant, there are really three things that we worry about. One, is it more transmissible? Two, does it have the ability to cause more severe disease than the virus we were dealing with? And three, does it evade vaccine protection? And if I had to choose between the three of those from a public health standpoint, the worst one is transmissibility. Because if you have a virus that is more transmissible, because transmission is exponential in nature, you can see huge differences in the number of cases that a virus can generate. And that is exactly the challenge that healthcare systems have, is the surge of patients coming in and the ability to provide them with beds and ventilators and oxygen and trained healthcare personnel. So I'm very concerned that the Delta variant appears to be about 50 to 60% more transmissible than the previous variants we were facing. there are also some reports that it can cause more severe disease, and it appears to have some ability to evade vaccine protection. Not completely, but there is some reduction in the efficacy of vaccines in preventing illness against the Delta variant. So it really emphasizes the importance of course, making vaccines available as quickly as possible. But in the meantime, while we're waiting for vaccines in many places, doing the critical public health measures to reduce transmission, wearing masks, canceling public gatherings. And by the way, this has been an issue in India. There has not been a uniform set of directions across states on how to do these public health measures. And I think that's so important for leaders to emphasize, so that the weddings, the religious gatherings, the sports matches, the election rallies, those are not the kinds of things that you should be doing when you have a pandemic virus circulating. That is exactly the kind of thing that leads to explosive outbreaks of a virus.
Right. So, if you were to, I mean, many of us, for instance, have been vaccinated now in the last 3 to 5 months. Now, as new variants come, and as assuming that the vaccine makers are also working hard, is it feasible that the next round of doses we get will be better prepared for new variants, or how does that work?
Well, the science is happening as we speak, and companies and scientists are looking to see whether you can use the same original vaccine and give an extra dose, a booster dose, and maintain protection against the new variants. There are also efforts to develop vaccines that are specifically tailored to these new variants, and comparing between the approaches to see what's better. The good news is that every company that is developing a COVID vaccine is looking at this. So my hope is that once we know what the science supports, that we'll quickly be able to develop the supply to target the challenges presented by that variant. Now, one question is what will happen with the variant development once a lot of people are vaccinated in the community? We may see that the virus evolves further to reduce vaccine protection. I'm not too concerned about that, because I think we've shown that we can quickly pivot and develop different versions of the vaccine that target specific variants if they appear to be a big problem.
And in your sense, as if you were projecting forward, do you see more dangerous variants emerging, or I mean, I know this is not an easy question to answer because you're essentially crystal ball gazing, but how could this variant or this particular pandemic change, evolve as we go ahead in time, and what could be the response to that, medical or otherwise?
Well, let me come back to a comment I made earlier, is that we have to be humble about what we know about this virus and what we don't know about this virus. A year ago, a lot of people, including very smart scientists, were saying that this virus would not mutate much and that would not lead to many problems the way we see with influenza. That proved to not be the case. The virus actually does mutate, and it can get around some level of vaccine protection. So I don't have my crystal ball, but as I also said before, we can hope for the best, that not much serious mutation happens that reduces effectiveness of vaccines, but we have to be prepared for the worst. And to me, the worst is that a more serious variant emerges for which the current vaccines do not work very well, and there we will have to have the science to support different vaccine approaches that can target that specific variant. But there are also some guardrails here for viruses. I don't think that this is going to turn into something that we just can't do anything about. That seems highly, highly unlikely. I think we have a great set of tools in vaccines and platforms that we've now proven that will allow us to address whatever we face with this particular virus in the future.
Right. So, if we were to go back 15 years or fast forward from 15 years to today, and you were asked to write a fresh document trying to anticipate what might come and lie ahead, maybe not just for the United States, but for the planet as a whole, what would you write today?
Well, the first thing I would say is that the science has delivered in a way well beyond our wildest dreams. Traditionally vaccines take between 7 and 15 years to develop. We developed them in less than a year. And it wasn't just the mRNA vaccines. It was other platforms that showed that they could move, and we, in our clinical and regulatory development strategies, could move very quickly. So that's great news. The organization you mentioned at the beginning, called the Coalition for Epidemic Preparedness Innovations, or CEPI, is a global organization that is funding vaccine development for epidemic viruses. it's now turning its attention to the pandemic threat and is proposing, as we speak, to develop vaccines against all 25 families of viruses that could cause pandemics in the future, and to do that in advance of the next pandemic so that we're ready to go with vaccines that can go right into clinical trials when the next pandemic happens, so that instead of it taking 300 days to get a vaccine, which is incredibly fast, that we shrink that down to 100 days. For the first time in history, we have the technology, the power to do that for many pandemic threats. And so that is going to be a critical element of our strategy going forward. And I really hope that governments will support CEPI, which has only asked for about $3.5 billion to get started. It'll take more down the line. But I think that's a very small investment given the threat and the opportunity. The other things I would say relate to the challenges that we did not anticipate 15 years ago of social media. Social media can be a tool for good, but as we've seen, it can cause huge misunderstandings, misperceptions. There's a lot of misinformation out there that has really gotten in the way of science-driven public health responses. And I think in the future, we'll have to be much better prepared to deal with this kind of dispersal of information and the echo chambers that can develop through social media. And finally, I would say that we now have confirmation that leadership matters a lot. You can take two countries that are identical in every way, put a good leader that is behind the science, is proactive, communicates well to the public, and a leader that doesn't have those skills in the other country, and they'll have vastly different performances in the next pandemic. We need to work on our leadership skills to ensure that they get behind the science, that they know how to communicate to the public actionable information, that they maintain the trust of the public, and that they make the necessary steps and investments to get ready for that worst case, that low probability but high consequence event on behalf of their people whom have entrusted them with that power.
Right, and absolutely last question, so if you have a mental dashboard of the progression of this disease, of COVID specifically, and how it's moving, and maybe the vaccine production, scientific efforts and scientific papers, how is that dashboard looking to you right now? And what are you tracking personally, and what gives you comfort, and maybe what gives you concern?
Well, I think we have some very promising news in places where you've seen high levels of vaccine uptake. And one of the great examples that gives me hope is when I look at a small town in Brazil called Serrana, where one of the vaccines from China was rolled out, called Coronavac, which has about 50% efficacy against preventing illness. When a lot of people in that community received the vaccine, the transmission plummeted. And we saw an almost elimination of deaths and a massive reduction in illnesses. So the great equalizer across vaccines is getting high uptake in communities. And I really expect and believe that we're going to see that eventually around the globe. So that gives me a lot of hope that we will develop some population immunity through vaccines and natural immunity that really makes it hard for the virus to be transmitted. So I do see light at the end of the tunnel. I do think we're going to come out of this. It's just a question of how long it's going to take based on vaccine availability. And eventually I think we'll get to a place where the vaccine is more like a serious influenza, if that, or maybe like the common cold. It'll take some time and a lot of vaccines that are equitably distributed around the world, but I think that that's where we're going with this virus.
And that's a most optimistic and encouraging note to end on. Dr. Rajeev Venkayya, thank you so much for joining me.
Thanks so much, Govind. Pleasure being with you.